And joining us tonight here is Dr. Seth Resnick, the chair of the Psychiatry and Behavioral Health Department for Advantage Care Physicians. Thank you so much for being here with us, Dr. Resnick.
Thank you for having me on, Jessica.
And we are just going to have a lot to talk about with you, because usually each night we have medical experts or a city or state official on. So we really don't get to spend too much time on mental health, which is just so important during this time. So I'm just really excited to hear from you, and I'm sure our viewers are as well. Before we get to that, though, do want to give you an update on where we are at today, because Governor Cuomo did, as we told you, announce that executive order that went into effect today, aimed to speed up COVID-19 testing processes. So the order directs all public and private labs in New York State to coordinate with the Department of Health to ensure prioritizing of diagnostic testing. We've been hearing about this, and finally some moves are being made here. So the governor also reiterated his call for help in this area from the federal government, and we'll hear more on that from the Coronavirus Task Force and President Trump this evening. Now, I do want to get to, obviously, something that has been going on each and every night at 7 o'clock. We know New Yorkers all over the city have been cheering and applauding and banging on really anything they can find to support our healthcare workers, our essential workers. This is just so incredible. This is the scene live right now at Greystone Manor in the Fieldston section of the Bronx. You can hear that neighborhood definitely expressing their thanks and appreciation for our healthcare heroes and all essential workers. And we know this has been going on all over the city, in Bronx and Brooklyn. We do want to show you how some other neighborhoods around the city are showing their appreciations as well, from Co-op City, Edgewater, Soundview in the Bronx to Park Slope in Brooklyn. If you do have a video from your neighborhood, just make sure to share it with us on our News 12 Facebook page. We know this is happening every night, and really, rain or shine, doesn't matter. People are getting out their windows and making noise, because this is really a moment each night that we can all come together, and it kind of brings us out for 1 second, Dr. Resnick, from that isolation that we are all in. A lot of people have been home for a month now, or even more than that. We know the kids have absolutely been out of school for that long. Bars and restaurants were ordered to close exactly a month ago. We've seen people working from home for even longer than that. But we also have our essential workers that are still getting up and going to work every day. So kind of as a whole, what are you hearing and seeing are the best ways to just really make sure that you are taking care of your mind and body during this time?
It's important to try to maintain some sense of normalcy when everything around us is changing. Keep as much as possible to your routines. Try to keep a schedule, even though things have changed. Even mundane things or simple things can keep the structure that you need in your day. And just giving yourself some time to rest and shutting off the TV or shutting off the news, and giving yourself a little break in your day when so much is going on and there's so much noise in all of our lives, in our heads right now.
Absolutely. And for our healthcare workers, kind of each person, depending on where they are at and their background and what they're going through at this stage during this pandemic and during this quarantine period, are kind of dealing with this mentally in different ways. So we do, of course, have number one, our healthcare workers, first responders, who at any given moment, pandemic or not, they are under so much stress, emotionally, physically, dealing with and seeing all of the trauma that happens across our city. So especially during this time where they're seeing just unprecedented numbers of, unfortunately, people dying, number one, and number two, you know, these hospitals and ICUs just overflowing. Let's start with them on how, you know, we could give them some advice on what to do in the short time that they are off shift or are home from work.
Mm-hmm. It's similar advice to what I give most people. Again, we're all in this together. We're experiencing this together, and we all need to support each other. And that's one thing that we can learn from this. So doctors are our heroes, and our nurses and our frontline healthcare workers and hospital staff, they're the heroes of the day. But they're human beings as well, and they need our support. When they go home to their families, they need to be able to just take care of themselves, shut the door, be with their loved ones, and just practice good self-care, really relaxing, trying to get their mind off their work, trying to separate themselves from their work. So important. Also, making sure that they can be patients as well as helpers. And it's so important that for everyone, and especially for these folks who are, going through a lot right now, to seek out help when they need it from colleagues. And if they don't have to use their own colleagues, they can seek out help elsewhere. It's out there.
Definitely.
And I encourage them to do that.
Yeah, and thank you for that. And they, definitely need this reminder more than maybe anyone else. But we do have obviously other people that are in different situations. We have the rest of the essential workforce that we see all over New York City that's making the city run still so that those heroes can get to and from work. And we know, especially in the Bronx and Brooklyn, those are everyday dads, moms, sisters, brothers that are going to the grocery stores, pharmacies to work, and the MTA, of course, to just keep the city running too. So for those workers who are stressed, the rest of their family may be at home, but they are an essential worker and still have to get up and go to work, and they are more stressed about work, money, rent than normal, and especially being kind of opening up their door and heading outside where the virus is. Or they could be exposed to it more so than, of course, the people that are able to stay home. What is your advice to them to stay on the job, of course, but mentally stay balanced?
Yeah. I mean, I first of all would just say, again, we recognize all the work that the healthcare workers are doing to really directly fight this pandemic. But it's a different challenge to be out there to help keep our city running and keep things as normal as they can be. Even if you're not directly fighting the disease, you're asking yourself, maybe, why am I going out there? I'm not doing anything. Do I need to be out here? It doesn't make sense. But if you're following the guidelines and doing what you can to practice the social distancing, and when you're on the job wearing your mask, you're really doing what you can to stay in control and to limit your risk. And then, just like when I advise the healthcare workers, the same advice I would give to other essential workers is when they come home to try to shut out the noise and take the time and build in that structure so they have the time to turn it off and rest. But I just want to say thank you to all of the police officers and the hospital workers and the sanitation workers and grocery store clerks and everyone out there who are really making the city run. They should also, maybe they're not used to seeking out mental health. This is a time, though, when we can all use each other's help. And so there's help out there. And I really just encourage, once again, folks to reach out to get a helping hand. They're doing so much for us. We can help them.
Absolutely. And I do want to talk about the kids who are home as well. Obviously, all different ages, but kids are home. They're home from school. They are home each and every day, all day. And if you have an opportunity, it seems that this is an opportunity, I should say, that you could be learning obviously so much more about your child or your teenager or your kids in general, but also in terms of their mental health, making sure that during these times when they're used to going to school, being with their friends, getting their energy out outside constantly, doing the activities that they have grown up to love and do, physically, mentally, or creatively, their after-school programs. I mean, they're being shut off from all of that. So what can you do to kind of maybe spark a different kind of conversation with your kids to make sure they're doing okay mentally?
Yeah, I mean, I think that there are opportunities here. You're absolutely right. When things change, we can hopefully get through this all together and grow from it even. And we'll watch our kids grow. I mean, my kids inspire me every day with this. In New York City, we don't have the backyards and the ease to go outside and get a breath of fresh air as much as folks do in other places. But if we can think of creative ways to have fun with the kids or let them have fun, and just keep a structured day and a normal day like everyone else, in terms of my advice, is what I would suggest to help in managing your kids' lives. Really, like when we're teaching, we're learning. When we're parenting, we're also learning how to be cared for in a certain way and to take care of ourselves. So helping your kids will help you feel have a better perspective on things. So if you can just normalize the situation for them as much as possible without giving too much information, put it in context, compare it to something that they may know, like the flu, maybe design their own masks, have fun with it, do something fun like make cards for their family who are in healthcare. Things like that can make them feel empowered.
And get the energy and thoughts and expression out as well. We're going to be right back. Stay with us. Welcome back to this coronavirus pandemic special report tonight. I'm Jessica Cunnington. We are talking all things mental health during this pandemic with Dr. Seth Resnick, who's joining us tonight, answering all your questions. And let's get to the callers who are waiting on the line. Nicolette from the Bronx. Thank you so much for calling in, Nicolette.
Hi, good evening. How are you?
We are good. We're good. We're here. Grateful to be here with you. What's your question?
And I'm grateful that I'm alive and I'm able to talk.
Yes.
Yes, my question is that my fears are taking me over. I have a very bad weak immune system. I'm dealing with lung cancer. I have a half a lung. And I have also anemia. And I'm just worried because 3 weeks ago I was going through the symptoms with the fever up and down. Nothing too terrible, low grade. I had the cough. I had bathroom issues and everything, and I would have cold sweats, hot sweats, and everything. And the fear of this all is just taking me over. And I don't seem to control myself and know I'm okay because I'm staying in. I'm a senior. I live alone. And I just don't know how to come to grips and hold on and not be so frightened. And I went through that for 3 weeks with it. I didn't get tested because my doctor said just so long as I don't have breathing issues that I shouldn't go out because it'll be worse.
And when there's so much that goes through your head with all this and all the fear, you're doing the right thing by following your doctor's advice, and keeping his words in your mind. There are ways of seeing your doctor, as you may have known, by calling them or getting help online. Some places are doing virtual visits. At Advantage Care, which is where I work, we're in many different communities, and we offer teletherapy. If you haven't seen a mental health professional before, I encourage you to do that. We can give you the support. You don't have to go through this alone. It's been 3 weeks since you've had symptoms, and like you said, you're still here and you're still with us, and it's hard. But your doctor might say that you've been through it and you're still here. But we're all going to be dealing now with just the trauma and the after effects of all of this. Now that we've been going through this for a while now, and now that we're kind of getting into the weeks and months of this, maybe it's the time, as symptoms aren't going away, that you look and take care of it in other ways. You're addressing your physical health, but it's important to address your mental health. It's all connected. So if you can get, there's medication that might be helpful at this time, and there are people to talk to really help you get control and work on some better ways to help you cope with that sense of fear and panic that you're understandably experiencing right now.
It's just too much. It's too much sometimes. And Nicolette, you know, step one is talking about it. The fact that you called in tonight to ask what you should do shows that you are so strong mentally. So I know it is probably so hard, and I can only imagine. And like the doctor said, you've already been through it. So to make this call tonight was a great step one, and to take some of the doctor's advice is step two. And we're here, we're with you, and call us again if you need absolutely anything. But I absolutely wish you the best, and you're strong. You are. Let's get to Maritza, who's on the phone over in Borough Park. Maritza, can you hear us?
Yes, I can.
How are you? What is your question?
My question is, I'm kind of like piggybacking off of what Nicolette was saying about the fear.
Yeah.
And I'm trying to actually, keep that in control with meditation, praying, and being just strong, because we're New Yorkers anyway, right?
Yeah, you got that right.
My fear about the community of Borough Park is that the majority of the people, like myself, we are complying with everything that we're supposed to do as far as mask and gloves and cleaning hands and all that. But the Hasidic community, they still walk around and not cover themselves, are still very much, going to the church where I can't go to church, or we can't go to church, so they close them down, right? But so we still have to do that at home and pray and do all of that. But they're still able to congregate and be in big groups and not cover themselves. So it's very, very, you have so much fear that even though we're taking care of ourselves, we're going to go out and catch something, because this community does have a high level of it. So what can you do? Because I've tried calling everywhere and sending pictures and whatever to bring it to light, but nothing is being done. So you seem like, you're just a target, kind of.
I think the best thing you can do is what you're doing, and taking care of yourself and your own, and making sure that you're following the guidelines, and staying home, staying safe, keeping socially distanced, and then, really you're reducing your risk tremendous amount. But it's hard to see, I think, I imagine, if people aren't following the guidelines, we're worried about maybe their health. And, again, we can only do so much, but, we're all sort of experiencing this together, and whatever we can do to help one another, as long as we're keeping ourselves safe, is the most important thing. Then we're doing what we got to do.
And we're doing all we can. Just like really anything in life, we are only in control of ourselves. But right now, we are all in this together to take those same measures and make sure we're all keeping ourselves safe for each other. We'll be right back. All right, guys, well, we made it through another week here Friday night as we head into the weekend. Thank you for calling in tonight with your questions, and thank you for your great advice. A lot of fear, a lot of uncertainty, Doctor. So kind of what is your final words for our viewers tonight?
Yeah. Well, I want to thank the viewers for calling as well and reaching out. We have been dealing with this for a little while now, and it's sort of like a triathlon, is what I say, or a workout. We were in the sprint part, and now this is kind of the marathon part. And as we head towards the cool down, we can maybe see some glimmer of hope on the other side of this. And there's going to be a lot of challenges ahead as we try to bring things back to normalcy. So we're going through this like New Yorkers in our own way can. We're staying strong, and that's what I encourage everyone to do, and help each other out like we always do. And now that we're in the thick of it, I really appreciate all the callers reaching out, and I hope that now that you can take the time to take care of yourself and make sure that you get the help you need through this. We can not only get through this, but we can, on the other side of this, see some growth and find that we've learned and grown and had some value in this experience, however hard it would be. And that could be getting to see a mental health professional.
You're so right. Doctor, thank you so much, and thank you for being with us.